Welcome back. If you remember in our last video, I talked about how to manage respiratory infections in children. Yeah, that was the last video I had. And before I concluded that video, I said I was going to tell you the things that when you notice them, you know it's high time to go see the physician. Okay, I think it would be better we have a replay.
Like I said earlier, infants, children get over some respiratory infections like colds and flu on their own in time with enough rest and care. But if you notice the symptoms are getting worse, they are getting worse, and your child is beginning to show some of the signs I am going to be talking about in my next video. If you notice that child start giving that signs, please and please do not hesitate to go see the doctor for proper treatment and diagnosis.
The first thing is when you notice that the symptoms your child is having is becoming worse. When you notice that it is getting worse than you can manage, you need no soothsayer to tell you that your child needs serious medical attention at that point. The second is about your child running high temperature and that you have tried everything possible to control the temperature, and it's not. The temperature ranging from 30 to 38 degrees Celsius and up is something that needs serious medical attention. Always make it a point of duty to seek medical attention. Even when you think that thing is small, there is nothing small when it comes to health. When you have tried to manage something, the first day, the second day, sometimes the third day, and you think it's becoming like it's going beyond what you can do, please, the next thing is to go see a physician, a trained personnel who has the knowledge more than you do. Okay, so coming back to your child running temperature, if you think that child's temperature is going higher and higher from 38 degrees Celsius, or even if it's not that, but you know that the child is running temperature and you have tried controlling it and it's not, please take that child to the hospital, because if you ignore something like that, it can cause seizure for that child, what we call the febrile seizure. Seizures caused because of fever. That's how a child will run temperature. The child will start having seizure. So to avoid all of this and other things that comes with it, please make it a point of duty to always seek immediate, instant medical attention when something starts going beyond your control. Okay? The third one is when you notice that the nasal mucus, the mucus coming out from your child's nose, is no longer milk or white or egg white, that it has changed to yellow or green. Please, this calls for serious medical attention, because it's a sign showing that that child's immune system is fighting serious infection. And to avoid what we call sepsis, because there is how you ignore an infection in your body, it will lead to what we call sepsis, and sometimes this sepsis can lead to death, depending. Okay, so when you notice that those mucus coming out of your child's nose is no longer white milk or egg white, that it has turned to yellow or green, please take that child to the hospital. Take it. The child seriously need medical attention. Go take it to the physician for proper assessment and diagnosis. The fourth is when you notice that the child is breathing so fast, gasping for air, maybe because of blocked nose or anything. Just you notice that the child is fighting, trying to breathe in air, and it's becoming difficult for that child, please take that child to the hospital. Another one is when you notice that the child is not feeding well, the child is not eating well, the child is not drinking well. Okay, and the child is becoming weaker and weaker. All of these things needs immediate medical attention. I will go again. When you notice that your child is running temperature uncontrollably, when you notice that the nasal mucus is no longer white but yellow or green, when you notice that all of the symptoms the child is having is getting worse, it was not like it was the first day, that is getting worse. When you notice the child is breathing fast, gasping for air because of blocked nose or any other thing that may have led to that child gasping for air, and when you notice that that child is not eating well or drinking well, please, these are the signs and symptoms that when you notice them, when you see them in your child who is having a respiratory infection, you know that that child needs immediate medical attention. I hope this video is helpful. And if you think it is so, as usual, please do not forget to like, to share, and to comment. I'll see you in my next video. But until then, do not forget to take care of yourself. Okay? Ciao, ciao.